Welcome to Empowering Plans, a show dedicated to identifying waste and undue expense in the health benefits industry, discovering ways to maximize benefits while minimizing costs, and empowering employers, administrators, and consultants to emphasize once again the benefit in benefit plan. Today's episode is brought to you by Lake Norman Benefits, offering innovative strategies and unique products for a more holistic approach to your benefit package. Now here are your hosts, the FIA Group's CEO, Adam Russo, Senior Vice President and General Counsel, Ron Peck, and Director Attorney, Brady Bizzarro.
Hello, everybody, and welcome to another episode of Empowering Plans with the FIA Group. I am the main host, the only one that matters, Adam Russo, and with me, I guess I don't want to say as always, because now you are always here, Brady, but in studio live with me is our legal expert, our guru, our Washington insider, Brady Bizzarro. Say hello, Brady.
Hello, Brady.
And, I miss him. Every once in a while, I'm so used to having him around.
He's an empty chair.
He spent the last couple of days with me in D.C. By the way, we're going to do another podcast about our amazing Washington, D.C. adventure. Brady was I'm surprised Brady's back. I thought Brady would just stay there forever. But anyways.
Me too.
I miss Ron. And Ron's dialing in. Ron Peck, our Senior VP and General Counsel. Say hello, Ron.
Hello, Ron, dialing in live from the scene of the crime.
Unbelievable. Ron is dialing in. Ron couldn't make it to work today. I guess he couldn't. His pants weren't ironed or they were wrinkled. He just couldn't make it in. So he figured he'd better off staying at home in his pajamas. I can picture Ron right now, like wearing his little pink slippers. Don't you think he's got pink slippers on right now?
I would bet so, yeah.
There's like a cigar. He's got a cigar in his mouth or a pipe with one of those Playboy robes. He's got a nice pair of silky pajama bottoms, but like a pair of bunny slippers.
He's watching Animal Planet too, for
There's
sure.
Definitely Animal Planet on television. But it's
Apparently,
great to be here.
You guys have got my you've got my office bugged, apparently.
We know exactly. And also, because Ron did this, and I feel bad. Ron is right. We should mention the great Pat Santos at the beginning of the podcast, not at the end. I want to say thank you to Pat for being literally the best producer for a podcast that no one listens to. So, Pat, great job there. So, folks, today we have a special guest. This guy is the ever controversial. He's the LinkedIn king. He doesn't have as many followers as me. I want to make sure everyone knows that. Maybe roughly half the number of followers I have. But this guy's a pretty big guy. His name is David C. Contorno. He's the agency president of Lake Norman Benefits. Say hello, David.
Good morning. I feel like I'm on the Mike and the Mad Dog show.
Dude, this guy doesn't get it. Like, we say, hello, David. He's supposed to say, hello, David.
Yeah. We'll get there.
Clearly, he's not a podcast follower. It's okay. We will hold that against you. You are done. This podcast is going to be rough for David this morning. But, Dave, thank you so much for being here with us. I just want to do a quick intro. So, as I mentioned, Mr. Contorno is president of Lake Norman Benefits. He's a native New Yorker who entered this field at the age of 14. Guys, is that legal? That's the first question I got.
I think barely.
Did you have a permit? Like a work permit, like from your high school, like guidance counselor to work?
I did not. It was strictly cash off the books, the way most people prefer it.
Were you entering the industry in the United States, or was this perhaps part of the medical tourism?
No, it was the U.S. And my first role was calling people at home between 6 and 9 p.m. to try and set up an appointment for whole life insurance. That was actually my first job. So I wasn't actually selling the products, but I was setting up the appointments for the agent to go in and sell it.
All right, so you're telling me a 14-year-old kid has not gone through puberty yet, is calling people at 7 o'clock at night while they're finishing dinner, and in that high-pitched voice, you're asking them to set up a meeting regarding whole life insurance?
That is pretty much true. I actually was one of the most successful they had ever seen because I was nailing down 2 to 3 appointments an hour, whereas the average person was doing 2 to 3 appointments over a 3-hour period, and I was paid by the appointment, so I loved it.
Oh, I mean, I can. If you called me, right? Let's be honest, guys. Right now, tonight, I'm at dinner, my kids, right? And some 14-year-old kid calls and says he wants a meeting about anything. I'm going. I'm going to that. Are you not setting that meeting up? I'm like, who is this kid? This kid's pretty amazing. He's got the chutzpah to pick up the phone and call me at my home, and I'm going to listen to this guy. I think it's a no-brainer. So a little bit more information on David before we start peppering him with questions. Here's the interesting fact of what I found in his bio. And for those of you that follow Mr. Contorno on LinkedIn, you'd be very surprised to hear this. In 2004, I still can't, I'm reading it, I can't believe it, received a broker spotlight and recognized by Blue Cross Blue Shield as the outstanding broker of service and in 2005 through 2014, United Healthcare honored him with the Echelon Award reserved for the top 1% of agents nationally. David, it seemed like you had a pretty good run going with the Bucas. What in the world changed? I mean, that's my first question. How has your business changed? I mean, it seems like you went from being the top dog of the part of the industry that you now rail against. What happened? Like, how did that all change?
Well, it actually, and I know you're setting me up to make even more fun of me with this story, but it started because about 5 years ago, I had a client meeting, and it was this lumber manufacturer in rural North Carolina that we had taken from a really rich plan to a really lean HMO plan. And I didn't know this, but I was walking into a hornet's nest. Now, to set the stage up, and I know you've heard me say this, Adam, but I drive a nice car. I was well paid by those carriers, and I have a driver that lets me get work done in between meetings. And so
my driver,
I get out of this.
I have a driver too. His name is Ron Peck. He's an amazing driver. He's amazing. Go ahead, keep going. Sorry.
But that's an important part of the story, because you got to understand, I get out of this big black car out of the back of it in this rural North Carolinian town, and I walk into this meeting of people not being able to afford their care or their medications anymore. And it was a very icky feeling for me, because I realized that in order to get the business, I literally had to take money out of their pockets and prevent them from getting access to needed doctors and medications. And the more I did that, the more I got paid. And it was just this awakening that said, I can't do this anymore. I can't sleep at night knowing this is what I'm going to, that every client hates meeting with me, every employee hates meeting with me. I want a more positive environment in my life. And I said, I either got to get paid a lot less money, or I got to deliver more value to my clients. And I opted for number two, because I like my car and my driver. So how do I deliver more value? And I recognized that first, just do the opposite of what's going on, because maybe we'll get the opposite results. And it really started that simple.
So you didn't feel so bad that you get rid of your driver, but you felt bad enough to change the way you delivered health insurance products to your clientele. So that at that meeting, that changed everything. So you were willing at that point in time. And that's where I'll be very honest, as Ron and Brady know, there are very few people in this industry that I look up to or feel like, I'm impressed by what they've done. But I can't imagine, I don't know if it'd be so easy for someone like me to be recognized as the top 1% of anything of a field, and to basically look at that field or that industry where I am the top dog and say, you know what? I know I'm the top dog in this field. I don't want to play in this field anymore. I want to actually work against you folks, because I believe that what you're doing isn't working. It isn't right by the American worker. So I give you kudos for that. So what changed? Like, what was the first epiphany, let's say, after that meeting that you had in that rural, factory with these employees? How did you learn about it? How were you educated to where you are now, where you're pushing for pure transparency, reference-based pricing, direct primary care? What was the start of that all?
Well, it's sort of everyone in the industry, even insurance carriers, say that insurance rates are going up because healthcare costs are going up. And one of the things that I recognized at the time was I knew absolutely nothing about how healthcare is paid for. Nothing. I barely knew what a CPT code was, but I certainly didn't know what a DRG was. I didn't know what an RVU was. I didn't know in any way how the carriers were paying for and setting the rates and reimbursing providers and hospitals. And if that was the cause of the problem, which everyone says that it is, how do we not know those things? It seemed crazy to me. So I started to dig into how are insurance carriers reimbursing providers. And what I found was across the entire spectrum, everyone benefits from higher costs, the way that the contracts are set up. The insurance company benefits, the PBMs benefit, the doctors certainly benefit, the hospitals certainly benefit, the drug companies benefit. And it really became a game of follow the money. And the more I peeled back the layers of the onion, of which there are many, many, many in healthcare, the more I found these perverse incentives. And so what I started to realize is what really matters in healthcare. There's three things that matter. You have the payer, which is the employer. If anyone calls a carrier the payer of healthcare in my presence, I will chastise them. You have the patient, which is the employee, and you have the provider, which is the doctor. Those are the only three stakeholders that matter in my world. Everything else is just noise. And so I look to eliminate that noise as much as possible. And when I can't, because I need some sort of mechanism to actually interact with the healthcare system, it's all about, at the very least, removing the disincentives, the perverse incentives, and at the most, aligning those incentives to the benefit of my client. And then to continue with that transparency path, the way that we get paid is a very transparent model in which we strip out everything, all overrides, back-end deals, commissions, bonuses, everything. And we say to our client, you're going to pay me a base monthly fee, but you're going to pay me a bonus if we hit certain mutually agreed upon metrics on actual reductions, not bending the trend. I'm not talking about doing less bad. I'm talking about actual reduction.
So it's basically pay for performance.
Yeah.
You perform, you get paid. It's no different than Brady. I mean, Brady hasn't gotten a paycheck in like, what, a year and a half now?
It's been a while.
I mean, he just doesn't perform well, but he's still here. He's like an intern, it seems, at our office.
Keeps trying.
Yeah, he keeps trying. But I want to take it to the next step. So obviously, David, we see you all over LinkedIn. I mean, you're posting every single day. And one of the big stories that has been developing, and something you've been preaching now for a long time, even though in the industry we've seen a growth in what we call HSAs, health savings accounts, you've been railing against this for a long time. I can tell you right now, I have very similar feelings. But can you explain to our listeners, and even to Brady and Ron and myself, why is it that you're so against HSAs, and what do you think they're doing that is harmful to our industry?
Well, for a long time, most of America was really overinsured for health insurance. When you have the single copays, the no inpatient deductibles or inpatient out-of-pockets. When I was born in the mid 70s, my mother paid nothing for that. But what we've done over the years in a way to either shift costs or try to engage consumerism, which hasn't worked, is we've removed coverage for the very things that we need day to day, which reduces the major claims. So you got to understand that most of the people listening to this are not the average American. So put yourself in the shoes of the average American with a household income of 80 or 85,000 and 2 kids, and you have no more than $800 or $1,000 in your savings account at any one time, and you now have this high deductible health plan with a $5,000 or $10,000 family deductible. Well, the type of care that you most likely need at that stage in your life is the day-to-day stuff. Maybe you have 1 or 2 chronic conditions in the family. Maybe you have your normal sick kid pediatric visits. Well, you've just removed coverage for all that. And what that does is it makes people very nervous and hesitant to interact with our confusing and expensive healthcare system. And so they tend to not do that. So we actually do see claims go down for the first couple of years when an employer puts in one of these high deductible health plans, but it's not due to people having more skin in the game or being better consumers. It's not due to that. It's due to them avoiding care. And what does that do? Well, that leads to larger claims. And what do the larger claims lead to? More bad debt write-off for the hospital and higher premiums for the carrier, which means higher deductibles the following year for the employer, which means to more bad debt write-off. And it's just this vicious cycle. We're going in exactly the wrong direction. And so it leads to bigger claims and worse outcomes.
I'm in total agreement with you on this, because I feel when it comes to HSAs that what we're doing as an industry is basically saying, okay, we, the administrator, couldn't figure out how to lower costs. The broker couldn't figure out how to lower costs. No one was able to figure out how to lower costs. So instead of, trying to do something about it, let's just give it to the employee and call it transparency. Call it, we're going to give them skin in the game and let them figure out how to lower the overall cost of care. That's all we're doing. We're passing the buck. It doesn't make any sense. The actual normal, typical person out there in the real world has no idea of the conundrum that we're involved with when it comes to health insurance in our industry. So I agree with you wholeheartedly. I'm against them. I think it's a very simple way for, like I said, an employer, a broker, or an administrator, or any type of specialist in our industry to say, well, you want to be able to keep your premiums low? Well, we have this new high deductible plan that we can offer. It's another way to pass the buck. It doesn't change anything. So I'm in total agreement. But I do have one last question.
And think of the hubris of these carriers who basically say, we couldn't do it, so now you do it, Mr. $35,000 a year employee. That's crazy.
So here's my question, right? What are you hearing from the other side as their argument as to why the HSAs are the greatest thing that has come to our industry? What are they telling you? What are their arguments?
Every time I dig into someone's pushback on it, they're dealing with a very white-collar audience, that 1% or 5% of America. And I am on an HSA myself because I am not the average American. I, first of all, know more about the healthcare space than the average American, and I make more money than the average American. So for me, it's fantastic. If I don't use it, I keep it, and if I do use it, I've used it. Big deal, because I fully fund my HSA. But it's done. Let's talk about that for a second. For those that's the other argument that says, well, when the employer actually doesn't use it as much of a cost shift and actually puts money into it, that's wonderful, but you've changed nothing. You haven't changed a single thing. So at least maybe the damaging impacts aren't there in that small percentage of the case, but there's been no positive impact either. So in my mind, it's either negligible or really bad is the impact of an HSA.
Hey, David, this is Brady, the intern. In reality, I'm not an intern, but I do have a question. I like what you said before about the parties that are involved here, identifying the payer, the provider, and having just the carrier, the three parties that you deal with, and trying to eliminate the noise and the perverse incentives. And I'm wondering what your thoughts are on one big area that we've been talking about a lot lately, and that is the PBM world and specialty drug prices, where essentially you have a really convoluted system in place of rebates and backroom deals where health plans don't necessarily know what's going on. Certainly patients don't know what's going on. And all the while you have costs going up of these specialty drugs, and the PBMs are making more and more money, because the rebates are larger and the percentage they're getting to keep is larger. So, what are your thoughts on, what needs to change in that part of our industry?
Well, I actually think some of the changes already exist. So that's one of those mechanisms that I mentioned earlier that we have to engage in to have to interact with the healthcare system. I have not found a way to mass deliver drugs to a patient population without using a traditional pharmacy network and therefore a PBM integrated with it. So the PBMs that we work with are very transparent, 100% pass through. We go through the contract on every line item to understand how they're pricing the drugs and where their revenue comes from. And we require them to be as transparent as us. But we also take, on top of that, a different approach. We have a PBM pharmacy last approach. So most people think of the pharmacy and therefore the PBM, even if they're not a consumer aware of the PBM, that's ultimately what they're doing, as the first place they go. For us, it's the last place. So we have all these sources outside of the traditional pharmacy and PBM channels for sourcing drugs between 20 and 70% below what we can get it there. And we make that, in general, we believe the way to lower costs is to provide better benefits overall. And so we create a pathway into the healthcare system for employees and patients that's zero cost. And we put a lot of things in that doorway, but one of them is the ability to source these maintenance medications outside of the PBM pharmacy space. So it doesn't work for your antibiotic, for sure, but for all the maintenance medications, all the specialty medications, we create a zero out-of-pocket doorway that we source it outside of those traditional channels.
So, David, I've been online. Like Adam said, you're a bit of a force on LinkedIn, and recently you and I have been on a chain of comments regarding a post that was, we'll call it controversial. I got to ask you, what are you seeing online that people in our industry are either saying or pushing back against that is just absolutely shocked you lately?
Well, that was certainly one of them. Let me preface it by saying that it's been overwhelmingly positive, and I do get some pushback from my business partners because they feel that I'm giving away a lot of the stuff that makes us successful. The way that I look at that, however, is if I were the lone wolf out there spouting these things, David Contorno from Mooresville, North Carolina alone is not going to be validated enough to get these to move forward. I think that the overwhelmingly positive, supportive, and validating feedback and comments that I've gotten is what has allowed me to become the quote-unquote subject matter expert in these non-traditional approaches. And it's the validity needed not just for me, but for the whole community of people that believe this way or have come to believe this way, that can move this forward. Now, there is some negative pushback, and I love that negative pushback. Sometimes I like it more than the positive because it's a challenging approach, and sometimes it allows me to think differently or change differently. But there was one particular post where a gentleman was calling out to self-funded employers and suggesting that they push them off into like an exchange-based, fully insured product, the unhealthy people only. And his belief was that you do incur a fine, but the fine is probably less than your specific deductible or your liability on that employee. And you can even supplement that with covering their out-of-pocket or gaps in coverage on the individual plans that typically are leaner or narrower networks than the group plans. And, first of all, that's just not in line with the culture we want to promote. We want employers that care about their employees, and they want to do more for those employees that are sick, not less, but in the right and responsible and best outcome way. And so there's a culture issue there. But from a legal perspective, there's so many red flags in that methodology. But most importantly, it's not necessary. I mean, when you properly manage a disease and control the claim, you wind up spending far less money and getting that patient or employee with much better outcomes. It's just not necessary. That is one of those tools, much like HSAs, for the broker or consultant that doesn't know how healthcare is paid for and therefore doesn't know how to reduce the cost of care. And so their only solution is to push them off the plan completely, which is just passing the buck. And you may have shifted who's paying some of those costs, but I think between the liability exposure and the fact that you've not improved the system as a whole, it's not an effective solution.
So, Dave, last question for me, and I really appreciate your insight and your joining us today. I think we all learned a lot. But where do you see yourself, your business, and this industry in 5 years? And 5 years from now, are we going to be talking about this stuff like, oh, yeah, remember then when we talked about reference-based pricing? That died. Or are we going to be saying, wow, I can't believe there was so much controversy about it. It's so obvious that everything's transparent. You can go on every website and see all the prices. 5 years from today, in 2023, where will our industry be?
It's funny. I feel a little hesitant to believe this, but I do nonetheless. I mean, I've felt over the years that we were going to hit a breaking point much sooner than we're at today. And I think we're really imminent to either a breaking point in a way where the government takes it over, which won't be good for any of us, or a breaking point where people start to think differently. But what I really do think will happen 5 years from now is that PPO networks as they exist will no longer be the predominant way of paying for care. If we can get those PPO networks out of the way, then we can get a lot more transparency, a lot more value-based care, and a lot more access to information that would allow us to design plans for employers that that incentivize intelligent consumer decisions. I mean, really, our big ask with our clients is to say, hey, you know that stuff you do when you buy everything else you buy, where you make a value assessment based on cost and quality? We just want you to do that in healthcare. I'm not asking them to do anything they don't already do. I'm just asking them to do it in a place they don't do it. And we have to make that very easy for them because the information doesn't exist. But I think the technology is already there and the demand is building for that information. We need to create the demand as much as possible and get PPO networks out of the way. If that occurred, I think there'd be a huge chasm that would open up and opportunities that I can't even think of right now for ways to improve the value of our healthcare system overall.
Well, that was very well said. And today with us was David Contorno, the president of Lake Norman Benefits. David, thank you so much for your time today. We appreciate it. And on behalf of Pat Santos, Brady Bizzaro, Ron Peck, and myself, Adam Russo, thank you for empowering your plans, and thank you for being with the FIA Group. Have a great day.